The sacral area of my buttocks.
That's it. Warm sensation.
And just a little sting sensation.
¿Cuántos segundos va a haber? ¿Cuántos cc?
So my assistant Ceci is making another bag of tumescent solution because we used 4 and in the chest and the abdomen. Now as he's numbing my buttocks, there's going to be spontaneous contractions of the buttocks muscles. This part tends to be a little bit more tricky. It's harder to numb the buttocks, especially since you have to use a lower amount. If you want to maximize the amount of tissue that you're going to transfer, you can't make the buttocks significantly tumesced because it won't allow for the skin to be stretched enough when you're putting the fat back in it, or moving the fat to the buttocks. So it has to be a little bit more concentrated. It tends to be a little bit more uncomfortable for the patient. So this part I'm expecting to be a little uncomfortable, but not so much so that I need pain medication. Now that is cold.
Si le puse lo mismo, pero quiere que le ponga... ¿Quieres que le ponga de esto también?
We always do a double check. My assistants, there's always 2 of them when we prepare these bags to make sure that they're putting in the appropriate amount of medicines in each one. So there's a double check system or even a triple check system to make sure that we're not making an error when we're creating the tumescent solution. Because with lidocaine levels at this high, that if you did make a mistake, it could be toxic, it could be life-threatening. So we always check to make sure we're using the appropriate amount, or and placing that in the bags. I feel like a baby. This is not fun. This is awkward. I hope it's not going to be like this when I'm 100. You know what I'm saying?
Vamos a hacer, we have approximately 300 tool fat transfer on the butts. You are going to apply 60 or 60 cc's in each. You are going to start on the right side, that's what we want, and then the left side. And you are going to feel a little pressure, Julio. So this is not anesthetic, this is not with anesthesia, so it's going to be a little pressure.
Are you gonna do it? You're doing it without tumescent?
Without.
Okay, well I'm gonna brave it out then. If Dr. Alvarez says do it without tumescent, we'll do it without tumescent.
If you can, we can apply. If you want, I can apply. As you wish.
Could you? Just to show that, because I use it with tumescent. I tumescent the buttocks.
Okay.
Ceci's making another bag for you.
It's already ready.
Ceci, you check the numbers?
Le ponemos de peso para infiltrar.
Como 50 si quieres. 50.
O con jeringa, lo podemos tomar con jeringa. Jeringa puede ser de 60.
Me das una jeringa de 60, por
Y una
favor.
aguja
Because normally, doctor, you do this with IV sedation, correct?
Yes.
Yeah, so
Yes.
we're doing it with totally awake, so we needed to mask the tissue.
Fine.
Are you okay? Yeah, I don't want any blackmail pictures.
Ahora sí, aquí.
¿Qué quiere? ¿Jeringa de 60?
Sí, va cargada con la condición que preparamos.
It's also expected that despite the fact that we're using tumescent anesthetic, there's going to be contracture of the buttocks muscle when the needle goes in.
Una aguja, yo estoy de color.
Una lamita, tienes una de central con este logo como para acá. El dedito acá,
Con inyección me hace el equipo de inyección y yo necesito infiltrar.
no. Y la jeringa de 60 pasas ahí la tienes, y una moca, para que le pongan la condición ahí. Sí. ¿Y dónde está la solución, César? Ok. Le ponemos unos 500 pieces de aves y se lo ponemos ahí en ese directo ahí.
Le pones así, por favor.
Unos 500 mililitros. A ver, espérame, ¿de cuál quiero?
Se le infiltraron con el cortaron.
Ya están las tijeras principales.
Uy, no.
Si guardan la otra solución, los otros 500, pues orden. No vayas a contaminar el equipo que vamos a usar después. Nada más una tablita como de 10-15 centímetros. Sería un poco de loco de anestesia en el par. ¿Están quitando esto, Julio?
Now here I feel, see that's a contraction of the muscle. I feel a little bit of stinging, pressure, but there's an automatic contraction. See, I feel a contraction of the muscle for the buttocks. This does not usually happen in either the abdomen or the breast tissue. It feels like you're getting a shot. That's what it feels like.
Esto ponemos 120 con la crisis.
Just a contraction.
ver.
The contraction, I'm sorry, I'm thinking of.
No.
I don't have butt implants.
I'm going to be jealous if you have to.
Now on the other side. Igual Julio, un poquito de pressure. Little by little. Little by little, relax. Deep breath.
Ahora dice en español, la belleza cuesta.
La belleza puede estar
Ya está